Hi, my name is Sheila Warnock. I'm the founder and president of ShareTheCareGiving, also known as Share the Care, and I'm also the co-author of the book Share the Care. Share the Care is a group caregiving model that allows friends, neighbors, coworkers, and acquaintances to come together to form a caregiving family to help somebody they know who needs support. And the idea is that group, that Share the Care group, becomes family if someone has no family nearby. And that's pretty important these days because 31 million people are living alone, oftentimes very far from family. It's a mindset that we need to get back to, where people are helping people routinely. We're facing this huge caregiving crisis by 2030, and we are not going to have enough health professionals or even younger people to take care of everyone. So it's very important that we as individuals start helping each other. Even if we only give 2 hours a week to help someone we know or we don't know, it will become part of who we are. It will become routine because caregiving should be part of life. That's what it's really all about. And I think most people really want to help other people. It's just that they have never done it before. They don't know how. They don't know where to begin. And that's where the book, Share the Care, comes in. It's about two friends, not the caregiver or the person needing the care, starting this group, but rather two friends who can pick up Share the Care and read chapters 2 through 9, which are written directly to them, so they can work with the family and the care recipient to figure out who we could invite to a meeting, what kind of help is needed, so that this group can get on its feet so much faster. And it's also about maintaining a group. Anybody can start a group, but a lot of times the burden of all the work falls on one or two people who burn out very quickly. This is about sharing that responsibility and rotating responsibility and supporting each other as caregivers to help someone. People have told me, because this has been around for quite some time, that it is a life-changing experience, especially if they've never been a caregiver before, because you can learn in the company of others who have that experience. So that's my mission. The mission of our organization is to bring a better quality of life to people who need support and to help alleviate the depression, the isolation, and the economic hardship of their caregivers. And it's been going gangbusters since 1995. It's in 48 states and 14 countries that I know of so far. So this conference is such a joy for me to be here. You know, it's an audience that is very hard for me to reach. The hospitals, the people who are involved in people-centered care, because people-centered care is what our little nonprofit is all about. And I think the opportunity to speak here today really made a big difference, because we've made a number of people aware that this model exists and it could be beautifully folded into any kind of person-centered care in any hospital, anywhere. I would love to see Share the Care used in schools that teach nursing and social work. I'd like to see it in community colleges and schools, high schools. Nobody teaches us how to be a caregiver, and I think that's a big missing link, especially in our society today, where we're very technology driven, and we have to get back to that person connection, and in particular when we're hurting with an illness or recuperating, or you know, we have a sick relative, or even just living alone. You have to have a support system. So the more people can start helping each other, the bigger support systems they're going to have when they need it. It's also useful for faith communities to use Share the Care, because faith communities are very important today because they supply a lot of the support to their communities. And so there's so many ways this can get our society prepared for the caregiving crisis. I would love Share the Care to become a household name so that when we're in the midst of that crisis, somebody will say, well, let's just start a Share the Care group and get going. Well, first of all, Share the Care changed my life. I was in advertising. I had no plans to be a caregiver, but life brings you to this place because everybody's going to be touched by caregiving. But doing the work to help pioneer this model and also now teaching it gives me such joy, and it's a gift. I've been given a great gift, and I want people to know that allowing their friends to help them is giving their friends a gift as well.